Hi, good morning. Welcome to Team Tap, Teach, Access, Partner. A few months ago, I received a call from a close friend of mine who is newly diagnosed with diabetes. Single mom of two, worked two jobs to make ends meet. Despite the education material provided to her by her nurse, she remained fearful, frustrated, mostly confused about her new diagnosis and how to manage it. Had difficulty remembering everything the nurse told her after she got home. This is not an isolated problem. Globally, there's about 462 million patients with type 2 diabetes. Study shows that retention of education is poor in the medical setting due to distractions, single modality of teaching, lack of repetition, and lack of partnership with the patient support system. When these patients do not have good retention of education about their condition, there is increased risk for negative outcomes and hospital readmission. We have a solution to break this cycle, to better educate patients and leads to better outcome for the patients and less burnout for nurses doing the education. TAP, teach, access, and partner with the patient. In this diagram, as seen on the left, both the patient and the nurse are overwhelmed. In the middle, the patient will partner with a nurse using the TAP website to learn more about their diagnosis of diabetes. In the end, on the right, this will leave the patient more supported and able to smile. This is a mock-up of our website, a website that will be part of the patient's learning journey, starting with the diagnosis of diabetes. Clinicians will guide the patient to our website. TAP will serve as a roadmap of multimodal education modules, videos, and text. Patient can continue to access these modules at home with their families and review them just in time when they need refresher on skills. They will also have access to nurse consultants who are able to partner with them as their coaches. Can be used by hospitals and primary care clinics. TAP help nurses practice at the top of their license. Expert nurse consultants will be subcontracted service as patient coaches. Expert nurses can reduce the load of other nurses at the units, reduce burnout by providing resources to accomplish education, reduce hospital costs for patients with diabetes by keeping them out of the hospital. For funding, nurse education time is reimbursable by Medicare. We will also seek grants to help get us off the ground. Our solution is specific to those newly diagnosed. It is free to the patients, but billable to insurance. TAP, Teach, Access, Partner. With our expertise in our team, we help nurses help patients one tap at a time.